This is a critical appraisal on the article, The Efficiency of MRI for Diagnosing Unstable Ligamentous Injuries Around the Thumb Metacarpal Phalangeal Joint. So the search strategy was if PubMed for English within the last 10 years, and then the search terms below. I added ulnar collateral ligament injury of the thumb to rule out elbow articles, and then I got 54 results from that. From that, I found this article. The objective of the article was to study whether the accuracy of MRI was comparable to arthroscopy for the diagnosis of ligamentous pathology around the thumb. So patients were anyone with unstable ligamentous injuries around that area, include several different ligamentous injuries and a volar plate. Between September of 2011 and August of 2017, they needed to have a MR and arthroscopy. They used MR imaging, both the 1.5 Tesla and 3 Tesla for diagnostic imaging. And then the comparison was comparing the findings on the MR to findings during a arthroscopic procedure, and that being the gold standard. Secondary comparison was between the two different magnitudes of MRs. And then the diagnostic accuracy of MR, sensitivity, specificity, and overall accuracy for UCL, RCL, and volar plate injuries. Level of evidence was a level 3, and the study design is a retrospective diagnostic accuracy study. Patient population was 56 eligible patients, and they only used 56 thumbs, 47 males, 9 females, so a little bit heavier on the male side. And then the inclusion criteria was just, as stated before, anyone with a ligamentous injury around the thumb. The MCPJ, and the exclusion was basically any worse injuries. So any open injuries or infections or previous history of injections or surgeries, and then any evidence of anatomical abnormalities around the thumb. An exclusion criteria was also arthritis. So for the methods, patients had to have pain or instability in the thumb that was exacerbated by valgus or varus stress, regardless of MR findings. And then despite conservative management for a 12-week period following the injury or one of the following conditions. So as your volar plate, avulsion fractures, and complete tears of ligamentous, including UCL, RCL, volar plate, diagnosed by MR. And then they performed MRIs. Some were 3.0 Tesla and some were 1.5 Tesla. And then the images that were acquired are below, so sagittal and coronal of different weights, so T1, T2. Surgical repair was done for the unstable ligamentous lesions that were proven under arthroscopic procedure, but if lesions were stable, the only debridement was performed. All surgeries were performed by the same surgeon, and there's more details on exactly how the surgery was done in the article. Diagnostic values from that are below. So sensitivity and specificity is pretty good, so the positive likelihood ratio for everything is moderate. Negative likelihood ratio isn't as good specifically for the UCL, but overall it's pretty good. And then this is just the diagnostic accuracy. I just grabbed an article that was looking at ultrasounds for UCL diagnosis. So this table compares the total versus just the UCL of the MR versus the one with ultrasound. So it is a little bit better for the positive likelihood ratio. Negative likelihood ratio is about the same overall, but is a little bit worse actually on MR versus ultrasound, but the positive likelihood ratio is definitely better. So the results of the study, 30 of the 39 thumbs that were used in the 3 Tesla MRI imaging corresponded with arthroscopic findings, and then on the other side of it, the 1.5 Tesla U17 cases, and 8 of them corresponded with the findings on the arthroscopic procedure. So overall accuracy of the MR was estimated to be 86.9%. The length of time from injury to presentation appears to have negative effects on the accuracy of the MR, according to some of the patients that were included in the study. It also shows that the 3 Tesla MR was considered superior to the 1.5, which makes sense when detecting collateral ligament or volar plate injuries of the thumb. This is the QUADIS. I got an 8 out of 14. And take-home points, MR has a higher sensitivity, specificity, and positive likelihood ratio than ultrasound. Negative was close to the same. MR is considered moderate for positive likelihood ratio, which would be ruling in ligamentous injuries of the finger. And then, like I just stated, 3 Tesla is considered superior to 1.5 for detecting collateral ligaments and volar plate injuries. And then ultrasound cannot yet be used as a proper screening tool in detecting injuries of the UCL and the thumb.